Thank you so much. And I'm so happy to be here. And thanks for everyone for joining the Skillsoft Reboarding webinar. If we can, let's go ahead and go to the agenda slide. Great, thank you. As the pandemic has continued, many employer and employee work arrangements have changed. In some cases, employees are continuing to work from their home locations, but some have returned to their physical work locations. In some cases, it's part-time, others have returned full-time, and in some instances, it's more of a hybrid approach where the employee may be working at home some and in the office some. But now we're faced with a resurgence of the SARS-CoV-2 virus with the Delta variant. So there's a lot of uncertainty in the workplace and what the right time is to bring employees back. I know that the health and safety of your workforce is your top priority, and there are and will continue to be impacts on how you bring operations back online and employees back to some aspect of normal. So today we're going to discuss what reboarding is, how reboarding differs from the onboarding process, some of the recent developments, and preparing the workplace for return to work. We're going to talk about additional skills that your managers might need and what management's role is in mental health and recognizing trauma and stress in the workplace. Okay, let's get started. So what is reboarding? Reboarding is shorthand for re-onboarding. In the past, before COVID, it might have been the process you followed when a temporary employee was brought on board full-time, or employees who had been laid off or furloughed have returned to the workplace. It's also the process of helping organizations resume operations and can help set your organization and employees up for success. Reboarding will help you minimize health and safety risks as employees return to your workplace. It addresses employees resuming previous job responsibilities and training employees for new jobs in your organization. It also encompasses training new employees to replace those employees who are not returning to your workplace, or possibly supporting the expansion of operations. Employers are also helping employees returning to work deal with issues arising from the pandemic, including extended shutdowns, financial challenges, the safety and health of family members, changes in their family obligations, and loss and grief. So in our conversation today, reboarding is going to apply when you're reopening or restaffing your physical locations after COVID closures, working with employees returning to work after layoffs or returning after working possibly at another company, and employees who have transitioned into new roles within your organization. So let's go ahead and do a poll question. What percentage of your employees transitioned to working remotely because of COVID-19? And if you can, take a minute and please select the estimated number. And I'm interested to see kind of, from a starting point where we're coming from for those of you that are on the webinar today. Okay, and let's go ahead and take a note of that. All right, so it seems like a significant portion of your employees transition to working remotely. And let's go ahead and ask another question, and that's going to be, what percentage of your employees will return to their work location in the next 6 months? I'd originally framed the question in terms of a couple of months, but with the Delta resurgence, I think in some instances it's going to be a longer time frame. So go ahead and, if you can, answer that. And I'll also share that Skillsoft just announced to their employees that they're going to delay the return to office for a bit longer. So as a company, we're taking more of a global approach and looking to the regions independently, but it looks like we are going to continue to work remotely for the next few months. And it looks like from the poll results, if we added everything up, 50, 75, so about 50% or more are going to return in the next 6 months. Okay, that's great to know as we go through the presentation today. Thank you guys for participating in that. And really one of the first questions we do want to ask is whether your employees are going to return or not. And A survey conducted by Stanford University last June reported that 42% of employees who were working from home, of the 42%, many had planned to remain at home. So your organization may be wrestling with, what's the right time to return employees? How do you encourage employees to safely return? And will they return or not? And I think we can all agree that the workplace employees return to will not be the same workplace that they left at the beginning of the pandemic. So it's essential for you to determine who will and will not be returning to physical locations. And in some instances, your employees may have anxiety about returning to your facility or workplace due to potential COVID exposures. Or they may still have family challenges, such as children at home who are continuing to learn remotely. If remaining at home, you really should think about their continued health and safety. Consider surveying your employees to determine if they can effectively work from home. If their home environment is conducive to work, they may need to make some adjustments, say from an ergonomic standpoint to their workspace at their home office, and whether they want to work from home or in your physical workplace, because every employee situation is different. Maybe there's not enough room for them to work from home, but they want to be safe in the workplace. So understanding what those challenges are and how to successfully bring them back into the workplace is probably your first consideration. So let's go ahead and look at how reboarding is going to differ from onboarding. So the onboarding process typically includes completing paperwork for insurance and other benefits, badging employees, having employees fill out their paperwork, completing medical exams, doing their initial health and safety training. But in my opinion, reboarding, although it looks very similar, occurs with a few adjustments. And these adjustments may include having the employees update HR documents like badging, completing employee paperwork, and so on. But it should also include ensuring that as the employer, you have identified the hazards and completed a risk assessment for those employees returning. And you also want to ensure that the employees are current with training requirements. And you use this time to communicate with the employees any changes that have been implemented, whether those are new or revised PPE requirements, expectations you may have for hygiene, any new or revised policies and procedures that have been implemented. Okay, let's look at some recent developments. I thought it would be helpful to look at updated OSHA and CDC guidance, and this guidance now includes the following recommendations. OSHA is recommending that all workers, including fully vaccinated people, wear face coverings in public indoor settings in areas of substantial or high transmission, unless their work requires a respirator or other personal protective equipment. And you can see I pulled the map from the CDC's website, and this was current as of August 23rd. And I don't think the situation has changed much since then, but you can see that the majority of the country is currently in high or substantial transmission of COVID-19 because of the Delta variant. So with that, OSHA would recommend that all people in working indoors wear a face mask at work. Employers are also suggested to require all customers, visitors, or guests wear face coverings in public indoor settings in areas of substantial or high transmission of COVID. OSHA is also suggesting that employers consider adopting policies that require workers to get vaccinated or undergo regular COVID-19 testing, in addition to mask wearing and physical distancing. If they remain unvaccinated, in fully vaccinated workers who have known exposure to someone who is suspected or confirmed COVID-19, they're recommending that they be tested 3 to 5 days after exposure and continue to wear a mask in public indoor settings for 14 days until they receive a negative test. So this is just some recent guidance from OSHA. It's not regulation, it's not law, but it's guidance that they would prefer that employers follow at this point. Additionally, some states, local communities, tribal organizations have also set more stringent requirements for employers. So my recommendation would be to ensure that, depending on where your employees are located, that you verify that all requirements are being addressed. And I want to mention one other change that was recent is OSHA had recommended that on the OSHA 300 log, employers were required to report adverse reactions to the COVID vaccine. That guidance changed at the end of May, and OSHA is now saying that employers do not need to report worker side effects from COVID-19 vaccinations through May of 2022. Okay, let's go on and next take a look at hazard identification. And really, this is an important task that should be completed when bringing employees back to work. And the reason it's important is based on current data, OSHA has tripled the use of the OSHA General Duty Clause to cite employers for COVID-19 hazards. In the absence of a specific standard, OSHA can and will cite an employer in the absence of a specific OSHA COVID or infectious disease standard for things such as respiratory protection, PPE, and sanitation. So if COVID has been spreading among your employees, you may need to review your policies and procedures regarding any potential COVID-19 exposure to employees and consider proactively developing an infectious disease plan. You can use a form to help you conduct a job hazard analysis, and it could be deployed electronically and completed by employees. If you're familiar with Skillsoft Certitude tool, that might be one thing that you could use to do that. Once they've been completed, they should be reviewed by your organization, and any adjustments made to the work environment as needed. OSHA has a sample format for conducting a job hazard analysis on OSHA.gov in the publication section. And the screen capture I have here is one that the EPA has available on their website as an example template for conducting a job hazard analysis related to COVID. So I think those are two good sources you could reach out to for examples of templates to use. When you conduct a job hazard analysis, you're going to complete 5 actions. And the first one is to break down the job into steps, identify any hazards employees are exposed to for each step, evaluate each of the hazards, and then recommend safety procedures and protection. You should periodically review and update the job hazard analysis and keep that information on file. Okay, let's look at what to do after you've completed the hazard identification. You would want to implement the hierarchy of controls. And the first step would be eliminating the hazard, which is really the most effective kind of control that can be put in place. At this point, elimination of COVID-19, until the current environment changes may be very hard to accomplish. And then the next one would be substitution, which would be replacing the hazard with a non-hazardous object, device, or substance. And there's no way to implement a substitution for COVID-19. But based on your analysis, your approach might change. So, for example, using substitution, if an employee normally takes public transportation to go to company meetings, to meet with clients, that sort of thing, you may want to consider letting them take a car service as an example, where the risk for exposure might be minimized. The next step would be to look at engineering controls. And these are changes to equipment that can isolate people from the hazard. Barriers would be an example of that, putting barriers between your employees and potential customers, or even segregating workspaces with barriers. The next step would be administrative controls, and this is the process and policy changes that impact the way people work to cut down on exposure to the hazard. And then finally is the use of personal protective equipment. And this is where employees would wear PPE for protection from known hazards. Okay. So once you've completed the hazard analysis, identified and corrected as many or addressed as many hazards as possible, the next step would be to ensure that your workplace is clean and safe. So you may want to consider doing a deep clean before bringing employees back into a physical work location. CDC has updated their cleaning guidance recently, and It's still true that people can become infected if they touch their nose, mouth, eyes after touching a contaminated surface. But in most situations, the risk of infection from touching a surface is fairly low. The most reliable way to prevent infection from surfaces is to encourage employees to wash their hands and use hand sanitizer regularly. You should always follow standard practices and appropriate regulations specific to your type of facility for minimum standards for cleaning and disinfection. This guidance is indicated for buildings, in community settings. This guidance that I'm providing is not intended for healthcare settings or other facilities where specific regulations or practices and disinfection may apply. So when no people with confirmed or suspected COVID are known to have been in a workspace, cleaning once a day is usually enough to sufficiently remove virus that may be on surfaces and help maintain a healthy working facility. Cleaning products containing soap or detergent can help reduce germs on surfaces and may also weaken or damage some of the virus particles, and which decreases the risk of infection. Disinfecting should be done using the US EPA listed cleaning agents, and that information is available on the EPA's website. Another consideration is ventilation, and we've heard this since the early days of COVID, but ventilation should be increased in your facilities if possible. Or you can allow employees to open windows and doors, for example, to increase ventilation. If you're changing equipment specifications or air handling, you should consult with an HVAC professional and your building maintenance to maintain, for example, relative humidity between 40 and 60%. And encourage workers when they're changing filters to wear the appropriate personal protective equipment. And one other note is we found through the COVID shutdowns is don't forget about the water systems. So after your water system is back online, you should check the water to or increase the flow of the water to minimize the risk of Legionella growth. Regularly check water temperatures, pH, disinfectant levels. Also consider heavy metals for when piping has been shut down for an extended period of time. You may want to have water tested or work with your local water authority to ensure that the water does not have any heavy metal contamination. And then finally, enforcing physical distancing or installing barriers, if they don't introduce an additional hazard for employees, is a great way to limit potential infection in the workplace and ensure that your employees are not negatively impacted by any of the changes that you make. For example, with barriers, this would include employees with physical limitations or disabilities, and make sure that their needs are addressed as well. Okay. Training. This is an important aspect of reboarding. So, as you know, many OSHA standards explicitly require employers to have to complete training for your employees in health and safety topics. Part of that's determined by your job hazard analysis. Part of it could be from your other, the types of operations that you have in your facilities. Any new employees or employees moving into new job roles must receive their initial training as required for the position. You may want to review the content that you're using to make sure it's up to date with the latest regulatory guidance and in line with current standards. As an employer, you have to provide training during regular working hours and at no expense to employees. Consider new options for providing training that may limit the spread of COVID or protect employees, such as virtual, online, or small group with social distancing. Your training needs to cover all hazards the employee may be exposed to, and this would include COVID. It's really important that you keep your training records and make sure that they are complete, because with reboarding, if you have good training records, you may be able to confirm that employees don't need to be retrained, or it'll help you ensure that employees are receiving retraining as required. And remember, after employees receive their initial OSHA training, those retraining topics must occur on schedule or when new hazards are introduced. So one of the best ways to manage training is by creating an employee training matrix after you have completed the hazard analysis. And the training matrix will help you define what training employees need, when they're required to have it, and how often it needs to be completed from a refresher standpoint. And as a takeaway from the webinar today, we're going to provide you with an example training matrix as a resource. Okay. Let's talk about medical considerations. So with employees coming back to work, and this is not an all-encompassing list, these are just a few of the more common requirements, but you want to make sure that for employees that do wear respirators, that fit tests are current, that their training is current. And, please note, face masks and surgical masks are not considered respiratory protection. Wearers of respirators are required to have training, fit testing, medical evaluations. They should be monitored. They should know how to do equipment cleaning, and you need to, as the employer, ensure that all of your record keeping is up to date for employees who wear respirators. If your employees work in healthcare or may be exposed to hepatitis B, ensure that their vaccinations have been provided and that the employee receives the required OSHA training. If tuberculosis is a hazard, then ensure that employees are trained on TB and have completed required respiratory protection training. Employers, and I'll just make the mention of this, employers may make a COVID-19 vaccine or vaccination series available. This would be at no cost to employees who are eligible, and you should provide information and training on the benefits and safety of vaccinations. We found that in a lot of cases that's very helpful to encourage employees to go ahead and get their vaccinations. OSHA's also suggested that employers consider adopting policies that require workers to get vaccinated or undergo regular COVID testing. And this is new guidance from OSHA, in addition to mask wearing and physical distancing. So that's just something else to consider from the medical standpoint. So just a couple more points on preparing the workplace for returning to work. We're going to talk about creating a plan, communicating, and taking precautions. So first, planning. Consider both your internal and external risks for your organization. An external risk would be, what does COVID look like in your community? What are the vaccination percentages, current caseloads, capacity for healthcare if there's an outbreak? That may help you make some decisions around when to return to work. Is it a good time to ask employees to come back? Internal risks could be, is how has COVID spread in your facility, or at other facilities in your company, or in similar, work environments in your community. So do you have adequate facilities for social distancing? If you ask all the employees to come back, can they be socially distant? Do the employees have adequate sanitation facilities for hand washing? Do you need to rethink the design and layout of your facilities? What needs to change if you're going to bring employees back? And what about employees who are vaccinated and those are not? How are you going to address that in your environment? Employers should also implement COVID-19 prevention programs. So any programs that are developed should include and engage employees. And should include employees, and they should know how to conduct a hazard assessment. Employees, sorry about that. So ensure the policies are in place to ensure separating, that you have the ability to separate ill employees from other employees, and a policy or procedure to be able to send employees home from the workplace if they're feeling unwell. It's also important to implement protections from retaliation. So for employees who raise COVID-19 concerns, you should have a policy in place for them. And as I mentioned earlier, it may be valuable to survey employees on their return to work preferences. In a recent Fast Company article, an example was shared where a CEO suggested that workers could lose benefits, such as healthcare, if they insisted on continuing to work remotely as COVID pandemic receded. And the staff reacted by refusing to publish their work for a day. The CEO apologized for the misstep and made adjustments to their return to work policy. So as part of planning, you should review your current work at home policies and let workers know beforehand when you will shift back to a return to work location. Create the plan and involve management employees in the discussions. Based on your hazard assessments, how are you going to handle any new risks for your employees? How will you implement changes for physical distancing? For example, encouraging employees to use stairways instead of elevators if possible, or will you limit passengers on elevators as an example? Identify changes in how work will be conducted, including the interactions between employees and customers. Who can use break rooms? How many people? What other common areas do you have in equipment? Will conference rooms be available for working, or will they be closed? How many employees will be allowed in conference room or small areas? What about the receipt of packages and materials to your facilities? How about the delivery of goods and services, if that's part of what you do? So if possible, continue to track who has worked which shifts, the locations that they've worked, contacts between employees and customers in case you need to do contact tracing if you do have a positive case. Plan for ongoing evaluation. How are the changes you implemented working? Have you identified areas for improvement? Consider feedback and suggestions from employees. Okay, let's look at communication. Employers should frequently communicate with their employees. This includes general communications and new policies to ensure that they're being followed. These are things like general safety measures and controls, how they are expected to work, when they are expected to be at their physical location, and how to report safety concerns. You can use formal and informal methods. Communicate with employees in a manner that will help them understand. So this could be providing communications in different languages, providing written communications, verbal communications, those types of things. And precautions. Protect your employees and have masks and tissues and sanitizer available. Ask your employees not to come in to work if they think they may be infected. That would be the best protection, for the employees that are at work. Ask them to isolate or quarantine at home if they think they've had an exposure or have tested positive. If you have employees who are at increased risk for severe illness, such as older adults, people with chronic health conditions, pregnant employees, consider developing policies and practices to reduce that risk at work, like allowing working from home or implementing separated workspaces, modifying job responsibilities. Consider further reducing risk by installing barriers. Minimize the in-person interactions of employees and customers where possible. And of course, encourage mask wearing, hygiene and distancing, and then reduce the amount of time that individuals spend with each other in direct contact. Okay. So another part of reboarding that you may not have thought about is upskilling and reskilling. And many industries and regions around the country are having challenges filling open positions. So there's definitely a shortage of available employees. It may be hard to attract employees in a tight labor market, and many of the in-demand jobs are hard to fill. So consider promoting from within or reskilling existing employees to take on leadership roles. This may require training on those skills such as management and leadership, as well as becoming a safety leader, but promoting, from within has many advantages. So one of the main ones is the lower cost per position. A recent Wall Street Journal article shared that replacing an employee can cost 20 to 30% of an annual salary on average when you include all costs, for that replacement. But in contrast, retraining an employee can cost less than 10% of their annual pay. So there's a significant cost reduction if you can reskill or upskill somebody from within to fill an available position. Also, in addition to any training requirements imposed by specific standards, employee training is one way for an employer to meet their general responsibilities under the OSHA Act for preventing violations. In the absence of specific requirements, the type of training that should be provided would be measured by what reasonably prudent employers would do in these circumstances. So, for example, provide training in a language in a manner the employees understand on things like COVID-19, hygiene, your policies and procedures related to COVID, and as always, document any training that has been provided. If you've developed or revised operating procedures, be sure to communicate these to all employees and document the employee's understanding of the information that was provided. Skillsoft has a tool called Certitude that can help you get that information out to your employees as an option. So maybe something that we can provide more information on. And then also provide any updated and revised safety and health requirements. Be sure that anyone involved in determining training requirements is up to date with COVID guidance because it's been changing so frequently. And also look at CDC guidance as well as state and local requirements. And consider upskilling or reskilling managers by cross-training. There's always a possibility that employees will continue to be out because of COVID. They may have to take care of family obligations, or they may have COVID themselves. It would be helpful to implement a skills assessment to determine where there are gaps in the manager supervisor skills. For new managers and supervisors, you may consider providing training on essential skills like communication, software tools, anti-harassment, and diversity. Okay. And then one other thing I'd like to speak to is the need for first aid mental health awareness. So most of us wouldn't think twice about helping a coworker who may have physically been injured on the job, and they may need immediate care. But when it comes to mental health issues, most of us may not know what to do. Work-related stress can have severe negative effects on mental health. Managers should receive training on mental health first aid and learn to actively listen, which is a big component to first aid mental health training, to actively listen to employees and encourage them to seek assistance when needed. Our current public health guidelines, such as social distancing, can make people feel isolated and lonely. This increases stress. Some signs of increased stress include fear and worry about their health, that of their loved ones. There's the added stress of job security, personal finances, loss of support services that they may have had before. So, these are just some key areas that, having an awareness of that, you may be able to help employees who are struggling. Everyone reacts differently to stress, and people who have lost a friend or family member to the disease are going to grieve and may experience a wide range of emotions that will take time to process. Also, people who are at higher risk of contracting COVID, such as older individuals or those with underlying medical conditions, may experience more anxiety. And people working in jobs with a high risk of exposure, such as healthcare employees or employees that are, working face-to-face with customers, they may also feel, significantly more stress and anxiety. Of course, there are other groups, many other groups that are vulnerable to increased stress and anxiety in this time. You may have unpaid family caregivers, children and teens, people with existing mental health conditions, those with existing substance abuse disorders, people that may have lost their jobs or restarting jobs. So, there's just so many issues that people are dealing with today. That, being aware of mental health, I think is an important aspect of, a manager's job in this time. So if you are responding to a mental health issue in the workplace, remember, it's not your job to diagnose or determine what problem the employee may be experiencing, but instead take a first aid approach by focusing on listening and encouraging employees to seek assistance. It's that active listening, when an employee talks about their emotional state. And then you can encourage those employees to get the assistance or treatment that they need. Employees may, be hesitant to seek treatment for a variety of reasons. So it's important to encourage all employees to seek the help they need. In the event of a crisis, get immediate assistance. Okay, let's go through just a few points to summarize. Evaluate, from a reboarding perspective, be sure to evaluate the hazards employees are exposed to at work. Ensure physical workplaces are clean and safe. Review returning employees' training records and provide any new or refresher training as required. Confirm that employees' medical requirements, such as respirator fit tests and medical assessments, are current. Create a plan for employees returning to work and communicate the plan and any ongoing changes frequently. Continue taking precautions against COVID-19 and look at reskilling and upskilling employees and managers to, assist with maybe labor shortages or just the need for additional employees. And finally, be very aware of your employees' mental health in the workplace. Okay. We have a list of resources that are available for some of the topics that we've covered today, and I think we're going to be able to provide this as a follow-up to this session. And on the next slide, I've just listed some reboarding course suggestions. So if you're currently using the workplace safety and health content, here are some suggestions that you may want to take a look at to help you reboard employees in the workplace. Okay, so let's go ahead and open this up for, I guess, questions.
Sure,
Melinda,
Donna, thanks so much.
Yeah.
Thank you so much. So we do have a few questions that came through the chat, and I just wanted to remind everyone that's on the phone, if you have a question, feel free to pop it right into the Q&A, and I'm happy to read it out loud for you. The first one that we have, Donna, is I have some employees who are not vaccinated. What practices do you recommend that I should take to protect my employees?
I think definitely, encourage all employees to wear masks at this point, and then continue the use of social distancing, use barriers if that's an option. If, the employee is, if you have employees that are at high risk and would prefer to work at home, maybe work specifically with those employees around, what's going to work for them and the organization as far as, when's the right time to return to work.
Great. And it's no wonder that the next one is also COVID related, but when can employees return to work after contracting COVID? That's a complicated one. So the CDC has provided some detailed guidance on that. Let me see if I can jump over to my notes real quick. I think the current guidance is, if they have COVID, they've tested positive and they are quarantining or isolating at home, I believe it's 10 days after the symptoms have resolved themselves. If they think they've had an exposure and have not been tested, again, you should probably follow the CDC recommendation, which I think is 10 to 14 days for that as well. So I would highly recommend checking the CDC's webpage for the most recent guidance. And Stacy, one of our participants, has validated your response and said 10 days from symptom onset. So Great. As long as your symptoms are reduced and no fever without the use of fever reducing medication.
Great, thank you, Stacy.
Perfect. And then I'm seeing one other question in here, and if others have other questions, feel free.
but what topics should employers cover in COVID-19 training for their workers?
So that's, I would follow sort of the basic guidance, what is COVID? How is it spread? How can you protect yourself? What type of hygiene should you take? The basics around that. Many of you may have already done training on COVID for your employees. I would strongly recommend doing a refresher as well. And that refresher can include, again, just the basics. So, what it is, how does it spread? How do you protect yourself? And then again, if you've been exposed, what are the timeframes for returning to work?
Awesome. And I've given folks permission on the line. There's a few others that I'm getting through that if you'd like to unmute yourself and ask a question as well, it doesn't have to be through Q&A. So if that's an option, if you're more comfortable with that, or other than that, I think we've answered all the questions. Anything else? Anyone want to come off mute?
So this is Stacy, the infamous Stacy that answered the other question. I just, not really infamous, but I just also wanted to put out there, just because it is a critical piece, that if you guys are doing contact tracing or somebody says that they've been in close contact with somebody that's contracted COVID, and close contact is 15 minutes or more within a 24-hour period cumulative within 6 feet. Make sure that the person that is the close contact waits 3 to 5 days before testing, because a negative test prior to that will give you results that are not necessarily the best results.
False, yeah, kind of false sense of negative.
Yep.
Great, thank you.
All right. Well, with that, I don't think we have any additional questions. Thank you, everyone. Thank you, Donna.
Thank you. Thanks. I appreciate everybody joining us today.